All right. Well, it's been a few days. Been busy at work and whatnot. A lot of things happening, so I'll go ahead and get into it. Now, first up, we have a Ryan Care slash Trumpcare update. Now, last video I did on the Obamacare repeal and replace, air quotes here, bill, the American Health Care Act. Last video I did, we basically had some evidence as far as what was going to happen. A good portion of also to a good portion of just the fact that it's Republicans proposing it, that it's going to be shit and it's going to end up kicking people off their insurance. But now those concerns are a bit more valid because Monday night, and I gotta say, this bill was dropped, what was it, like a week ago? I mean, the Congressional Budget Office must have been pulling some overtime to get this thing out. But the Congressional Budget Office, or the CBO, has released their analysis of the, let's just say Trumpcare. You know? They try to say, like, oh, Obamacare. You know what? Trumpcare. Because guess what? If this actually does happen, you're going to have to own that shit. So, Trumpcare it is. Anyway, they have finished their first sort of like their run through, their analysis on Trumpcare. And yeah, the news isn't good. According to the CBO, they did an analysis and compared it to what we currently have, the Affordable Care Act. And this is what they came up with. As far as people losing their coverage, the CBO projects that, in comparison with the Affordable Care Act, that by 2018, 14 million more people would be uninsured. It gets better. That by 2020, 21 million more people would be uninsured than would be if they just left the ACA alone. Now, by 2026, 24 million. So within a decade, or 10 years from now, if this bill is passed, 24 million more people will be uninsured. And that basically, in total, that would mean in total in the United States, in the richest country in the world, we would have 52 million Americans who would not have access to health care. Or technically they would have access, but they wouldn't actually be able to afford it or be able to get it. Now, in some cases, it would be because of rolling back the individual mandate and they wouldn't have it. But in a lot of cases, it's because they won't be able to afford it. Now, right now, or in 10 years from now, they did a comparison, of course, like I said, with what we currently have. And under the existing Affordable Care Act, in 10 years, we would have 28 million uninsured. This would practically double it. But, of course, the Republicans, the GOP, Ryan himself here, was, quick to jump on the parts of the report that says that, it would save us money and premiums would go down. Okay, but it doesn't cover as many people. Do you see the problem with this way of thinking? Well, of course he doesn't see the problem with it. Okay, let me go through this real quick. Some of the ups and downs. Other than that, that's the big one that a lot of people are covering. Is that the simply, it's gonna it's gonna leave, it's gonna result in total over 10 years, total of 24 more million people with no insurance. That's some improvement, isn't it? Anyway, let me get into some of the little deeper down little details here. Now, the report also states that uh, overall premiums would actually be uh, lower. Now, let me make sure. I want to make sure this is clear. It does not say that they would be like lower. Like for instance, if you pay $200 a month in premiums, that it would go down. What they mean is, and this is something the GOP, the people that are still for this turd of a bill, are saying. What, I forgot what I said at the beginning of the sentence. Fuck it. Anyway, okay. GOP is well. Let's not label all of the GOP in one lump here, because honestly, there are some people that are pretty far apart in that party, as far as this bill goes. So let's just say these people like this: Paul Ryan, the traditional, more, corporate cocksucker Republicans. Those types. The types like that who, try to brag about how they're essentially gonna be booting people off of healthcare. A few hours after they attend a meeting with insurance industry lobbyists. I'll put a link in the description to that article. Asshole. Anyway, those people, the people who actually support this thing, are quick to point out that, your premiums are going to be lower. Your premiums will go down. No, actually, no. What they mean, what the report says, is that the premiums will be up to 10% lower than if Obamacare or the ACA had just been left in place. Okay? So that's the thing. They will still go up, but they will go up at a rate at a 10% less rate than under the Affordable Care Act. So, 10 years from now, whatever your premiums would have been under the Affordable Care Act, they will be potentially be 10% lower, potentially, than that. Not that they're actually going to go down, but they're going to be less. However, that is after an initial, let's see, now that's over 10 years. Now actually if this bill is passed in its current form, between 2018 and 2019, they actually project that premiums will jump between 10 to 20%. And that's mostly because of the getting rid of the individual mandate. You get people leaving the healthcare market because there's well, fuck it, I'm young, I'm healthy, I'll just pay the fee when I do need healthcare. And then after that, so basically they're going to go up 15 to 20%, and then after that, they're going to kind of even off a little bit and not continue to rise as much as they would have under the ACA. So really, you're really not looking at much savings at all. And it also gets a bit worse. See, in my last video on this, I mentioned that they are replacing the current subsidies that people get, with a fixed tax credit. Now, the main differences between the two is that the subsidies, if you make below a certain amount of money and you get your insurance on the health, like healthcare.gov or marketplace or whatever, you get a subsidy based on how much money you have, and how much the plan costs. Essentially, you are required to pay a certain amount of your income towards your premiums, and then the government covers the rest. So even if premiums went up, you'd still be somewhat insulated from that. Under this new system, you won't be, because they're going to give you a set dollar amount based on your age, and to hell with whatever the costs of the premiums are. And also, it gets worse. So, basically, the premiums will go up. They will continue to go up, just as they're continuing to go up under the Affordable Care Act. And the poor will quite possibly be in a harder position, in a worse position to try to be able to pay for them. Especially if, okay. See, it's a complex thing, all right? It's a lot to try to get through in an orderly fashion. But anyway, so we've covered how many are going to lose coverage, covered the rate increase. Now I'm going to cover some of the shittier parts. Because believe it or not, that's not the shitty part. That's not the really crappy parts of it. Here's the real turd in the punch bowl here. If you are young and relatively healthy, your premiums might actually go down. The amount you pay, like, because of the subsidy you get, because of what the premiums are going to be, you might actually save some money. That is true. However, your grandma's getting screwed. Plain and simple. Grandma, grandpa, they're getting absolutely bent over with this deal. Because some of the various things that were done, some of the, for lack of a better term, some of the fuckery put in place in this bill to make it work, or to try to make it work, is that, for one, insurance companies are going to be allowed to charge up to 5 times more for elderly enrollees than for younger enrollees. Now, you could charge more for under the ACA for the elderly. It was capped at 3 times more. However, because of the subsidy, it wasn't as bad. Because, as I said, the subsidy was based on a percentage of your income. So the more the premiums cost, the more of a subsidy you got. Under the fixed rate or fixed tax credit, they would get a certain amount. I think for the upper end is like $4,000 a year to help with premiums. However, some of the projections I've seen so far would put premiums for, say, someone who's in their 60s in the neighborhood of something like $14,000 a year. That is insane. And this is someone this is a retiree living off of Social Security, which they're trying to cut as well. And they're going to charge them like practically half their annual income for health insurance. So, that's one thing I will put out there. If you're young, if you're healthy, if you're like, oh, okay, well, hell, at least I won't get affected. I'll probably save a few bucks. Remember, elderly, like grandma, grandpa, whoever, anyone in your family that you know of, they are going to get absolutely screwed with this, so that you can get those cheaper rates. Keep that in mind. Another thing, too, that is going to help with the lower premiums is that the Trumpcare bill will actually remove a good number of the standards for various plans. For instance, another thing to keep in mind, so the report cites the ability to offer plans that don't meet the coverage standards of the ACA. as one of the factors that will reduce premiums. And see, that's one of those things. Okay, this is something that really kind of pisses me off, because these jack-offs, whenever someone like whenever Bernie would bring up the idea of, say, free college tuition or free health care, that's just sort of the catchphrase of it. It's like, we know how the system works. Anyway, they would always respond with that stupid, just childish response of, oh, well, you know, nothing is really free. However, they seem to, like, yeah, we get it, dumb shit. We pay for it through taxes. You know, as opposed to dropping bombs on people, we put the money to healthcare. But anyway, they conveniently forget about that statement when it's their stuff that they want to push over on you. When it's their crap that they want to shove through and try to slip under your nose. Like, for instance, these lower premiums. Again, I hate to break it to you, Ryan, but nothing's really free, okay? Someone's doing the paying, okay? All right? You're not getting these lower premiums because these insurance companies, out of the goodness of their heart, are going to charge you less. You're getting the lower premiums because either the coverage is worse and doesn't meet the standards that it's held to now, or because they're able to screw so many people somewhere out of so much more money that it offsets it and lets you have a lower premium. All right? Like, it's absolute horseshit for them to say, like, oh, it's just going to lower premiums. Everything's going to be cheaper. No, it's not. Someone's doing the paying. It may be you, it may be someone else in the system, but someone's paying for it. So, but anyway, yeah, as I was saying, they can charge the elderly up to 5 times more than they can under the Affordable Care Act. They can also offer you plans that don't meet the standards of care that the Affordable Care Act mandated. See, that's the thing, too, that people don't think about, is that was one of the issues of the things with the Affordable Care Act, was that it required insurance plans to actually cover certain things. So they couldn't just say, we're not going to cover maternity care, or we're not going to cover breast cancer, or we're not going to cover prostate cancer. That when technically you could do that before. So it required those plans to meet a minimum coverage. And people always will bitch about that, like, oh, I like my health plan, but it got taken away when the damn Obamacare got enacted. That was because it didn't meet the fucking standards. It was because your health care that you had was so shitty, it didn't meet, like, the standard, what should be the basic care, like, level of care or coverage. And that is why it was changed. You know, it wasn't some evil government scheme to screw people over. It was trying to get people on better health care, which this bill mostly guts and gets rid of all of that. So this is essentially, what this is essentially is a rollback to almost what we had before the Affordable Care Act. It's just slightly less terrible. And they still have to cover pre-existings. They can charge you more for it, but they still have to cover them. Other than that, it's like, it's a piece of shit. So, that is my take on it. If you're still with me at the end of at this point, congratulations. Thank you for watching the entire video. And see, I will post the relevant links below. Feel free to like, comment, subscribe, and I'll see you on the next one.